Hey everybody, just wanted to go over quick different way of doing a Cric procedure that we found kind of works a little bit better with the switch to the trach tubes instead of the cut down ET tubes. The difference being with these trach tubes, the ends of them are squared off, whereas the normal cut down ET tubes have the beveled end on them. With the supplied introducer with these trach tubes, it kind of rounds the end a little bit, making it a little bit easier to insert into your incision. So in order to utilize that and not have to remove that inducer to use the bougie with the Scalpel-Finger-Bougie technique, I'm going to show you a way that you can use the backside of the scalpel as kind of a backboard to help you save your landmark there and assist you in the insertion of the trach tube. So nothing's going to change at all procedurally with the incision. The incision is going to be the same. The only difference is going to be after your incision, what you're going to do from that point forward. So there's going to be a different video kind of overviewing the Scalpel-Finger-Bougie technique. You're going to use those same techniques, just going to be a little bit different when utilizing the backside of the scalpel instead of the bougie. So again, we'll say that this is all prepped, wiped with your alcohol prep. Let's put this here. Again, you're going to do your same shift to find midline for the airway. Do your laryngeal handshake with your middle finger and thumb as outlined in the other video. Use your pointer finger to locate your landmarks. Watch just as the same. Locate your landmarks. We're going to make our vertical incision through that first layer of skin. Once you're through that skin, feel for that membrane that you're looking for. Locate your membrane. Drop in for your horizontal cut towards you. Flip away from you. At that point, carefully, you can insert your finger, saving your incision there. Remove the scalpel. You can close the safety shut. Flip the scalpel around to the back side and insert into that incision, basically taking place of the bougie to save your spot inside the airway there. Then leaving the introducer in the trach tube. You ramp it right down, kind of as you can see, using that scalpel as a backboard and into the airway. Remove the scalpel and then secure with either tape or the supplied straps. Remove the introducer, inflate your cuff as you normally would. Again, just another way to insert the trach tube without having to remove the introducer. That kind of gives you a little bit more rounded tip instead of having to remove that in order to replace it with the bougie. It keeps the tip of the trach tube a little bit more rounded, similar to that bevel of a ET tube, versus maybe running into some difficulties trying to railroad that squared off end of the trach tube through your incision in the airway. Thank you.